What if the way you sleep tonight could silently trigger a stroke by morning? That's not just a dramatic question, right? It's backed by new research. Studies now show that nearly 1 in 3 strokes occurs either during the night or within the first few hours after waking. These aren't caused by emotional stress, cholesterol, or a missed medication. In many cases, they're quietly rooted in something most people never think about: how they sleep. Just last month, I saw a 68-year-old patient, active, ate well, had normal cholesterol, but suddenly suffered a stroke right after waking up. No warning signs. It turned out the culprit wasn't in his diet or genetics. It was his sleep position, compounded by a few other bedtime habits. Before we dive into that, welcome back to the show. I'm Dr. Ethan, and as always, I'm here with my good friend and co-host, Dr. William Lee, to explore the hidden science behind everyday health decisions. Thanks, Ethan. You know, most people think of strokes as something that happens suddenly and randomly, but the reality is your risk goes up when your circulatory system becomes more fragile. And that starts happening around age 50. As we age, blood becomes more viscous at night. Blood pressure tends to spike with position changes during sleep. And minor anatomical habits like how you position your neck or heart can have major consequences. We can't control the exact moment we fall asleep, but we can control how we sleep, and that makes all the difference. In today's episode, we're going to uncover 5 dangerous sleep habits that increase your stroke risk overnight. We'll also reveal the 2 safest sleep positions for your brain and heart, and share easy tips to make your bedroom a stroke-proof zone. If you care about protecting your brain, your heart, and your future, go ahead and like, share, and subscribe. This might be the most important episode you hear this year. The scary truth is that many strokes don't happen during stress, but during sleep. That's right. When your body is supposed to be recovering, some hidden habits might actually be putting silent pressure on your brain and heart. Most people don't realize it, but tiny choices we make before and during sleep can disrupt blood flow, raise intracranial pressure, and even trigger plaques in our arteries. Let's walk through 5 dangerous sleep habits I see too often, especially in patients over 60. The first one might surprise you: sleeping flat on your back without a pillow. This is more common than you'd think. A lot of people believe that sleeping flat on your back, completely horizontal with no pillow, is somehow good for the spine. But for older adults, especially those with high blood pressure or mild sleep apnea, it can be a recipe for disaster. Here's what happens: that when your head is level with or lower than your heart, gravity causes blood to pull toward your upper body. That might not matter much when you're young, but as you age, your brain's blood vessels become more fragile. This position can increase intracranial pressure, reduce oxygen flow, and strain the microvessels in your eyes and brain. Some of my patients wake up in the middle of the night with pounding headaches, dizziness, or blurred vision. Many never connect it to how they're sleeping. And the scariest part, these symptoms are often early warnings of deeper circulation issues. Many strokes or microbleeds in the brain. So how do we fix this? The key is elevation, but not too much. We recommend using a medium-height memory foam pillow to gently elevate the head so it's about 15 to 30 degrees above the heart. That's just enough to help venous return without straining the neck. If you're someone who struggles with acid reflux or snoring, you might also benefit from an adjustable bed that slightly lifts the upper body. This takes pressure off the diaphragm, improves breathing, and reduces nocturnal blood pressure spikes. And that's just the first habit. Stay tuned. We've got 4 more silent sleep risks coming up. Let's move on to the second dangerous habit: sleeping on your right side, especially for people with heart problems. Now, most people never think twice about which side they sleep on, but the deal is that the position of your heart in the chest cavity actually matters. When you lie on your right side, your body weight shifts, and one of the major veins in your body, the inferior vena cava, which brings blood back up to the heart, is slightly compressed. That vein runs along the right side of your spine, and pressure on it can slow down blood return, making your heart work harder to pull blood back in. Exactly. And let's not forget that the human heart tilts slightly to the left. So when you lie on your right side, the heart gets pressed toward the chest wall. That can restrict its movement just enough to reduce its pumping efficiency, especially in older adults whose hearts are already under stress. For most healthy people, this might not cause major problems, but for someone with high blood pressure, congestive heart failure, or even occasional nighttime chest pain, this sleeping position can worsen symptoms. In fact, some cardiologists now believe that chronic right-sided sleeping in people with cardiac issues may increase nighttime arrhythmias or cause subtle drops in oxygenation. So what should you do if you fall into that category? Here's the practical fix. Try sleeping on your left side instead. This position not only takes pressure off the inferior vena cava, but also allows the heart to pump more freely by giving it space to move. And if you find yourself flipping back in your sleep, there's a simple trick. Use a body pillow. Hugging a firm pillow in front of you helps keep your spine aligned and prevents accidental rolling. We'll dive deeper into why the left side position is ideal in part 3, but for now, if you have any history of heart issues, avoiding right side sleeping might be one of the simplest and most powerful changes you can make. Next, here's something I see often in patients trying to get comfortable at night, stacking 2 or 3 pillows under their head. Many people do this thinking it helps with breathing or acid reflux, especially as they get older. But the truth is, using too many pillows or an overly high pillow can quietly cause more harm than good. When your head is pushed too far forward or upward, your neck bends unnaturally, compressing the blood vessels that run along the spine and up into the brain, especially the vertebral arteries. These arteries are critical for delivering blood to the brainstem and the inner ear. If they're even partially restricted during sleep, you might not notice it immediately, but over time it can lead to poor circulation, tension headaches, neck stiffness, and even dizziness when changing positions in the morning. Yes, and I've had patients who wake up with stiff necks, tight shoulders, or that awful half-head headache, thinking it's stress or aging. But after adjusting their pillow height, these symptoms often disappear within a week. That's how powerful proper alignment is during sleep. What's sneaky is how chronic over-elevation of the head affects microarticulation in the brain. Over time, it may even contribute to tiny vessel damage, making the brain more vulnerable to silent strokes or transient ischemic attacks, the so-called mini strokes. So how do we fix it? Take it easy. Use one well-designed pillow, preferably a low to medium height memory foam pillow that gently supports the curve of your neck without pushing your chin toward your chest. And if you truly need to sleep on an incline, for example, due to acid reflux or breathing issues, use an adjustable bed base or a wedge that lifts your upper body evenly, not just your head. That way your neck stays neutral and blood flows smoothly through the arteries feeding your brain. Sometimes the smallest adjustments, like switching your pillow, can make a huge difference for your long-term brain and heart health. We continue to move together to one of the most common sleep positions I see, especially in older adults, is the fetal position where the person curls up tightly on their side with their knees drawn up toward the chest and the chin tucked in. It's instinctive, comforting, and even soothing emotionally. But from a circulatory and respiratory perspective, this position can quietly set the stage for some real issues overnight. When you curl up tightly like that, the spine bends forward, the chest compresses, and the lungs have less room to fully expand. Over time, this leads to shallow breathing throughout the night. And when oxygen intake is reduced, so is oxygen saturation in the blood, something that becomes even more risky with age, especially for those with underlying cardiovascular or pulmonary conditions, right? We often overlook how posture during sleep affects oxygen delivery to the brain and heart. And in this curled up position, there's also increased tension in the neck, shoulders, and upper back. That kind of prolonged muscle tension can compress small blood vessels around the cervical, spine, and base of the skull, leading to poor circulation in that region. In some patients report waking up with dull headaches or neck pain, and they never suspect their favorite sleep position is the culprit. That's why we recommend a few gentle modifications, not to eliminate the position entirely, but to make it safer. Try gently straightening the legs a bit instead of tucking them up tightly. Keep the spine in a more neutral alignment and avoid excessive curling of the upper body. Using a body pillow or full-length cushion between your knees and arms can help maintain a more natural, relaxed posture without triggering that coiled-up reaction during sleep. It's not about sleeping stiffly, it's about sleeping smart. Small changes like these can open up your breathing, reduce pressure on the heart and brain, and improve your overall sleep quality. Last, but certainly not least, here's a habit that often flies under the radar, but carries serious consequences: going to bed right after eating dinner or drinking alcohol. It may seem harmless at first glance, but for people over 60, this combination can silently set the stage for a stroke. Let's break it down. When you eat a large meal, especially at night, blood is redirected toward the digestive system to support the breakdown and absorption of nutrients. But this also means less blood is available for the brain during those crucial nighttime hours. In healthy adults, the body adapts, but in older adults, particularly those with narrowed arteries or cardiovascular risks, this redistribution of blood flow can increase the likelihood of lightheadedness, dizziness, or even fainting during sleep. And if we add alcohol to the picture, the risk gets even higher. Alcohol acts as a vasodilator, meaning it suddenly expands blood vessels, which can lead to a drop in blood pressure. For seniors, especially those with pre-existing plaque or unstable blood flow, this sudden drop followed by compensatory spikes can trigger unpredictable blood pressure swings. These fluctuations are dangerous because they stress the vascular walls, potentially causing a rupture in weakened vessels or forming clots in areas where blood flow becomes erratic. You may recognize the warning signs: waking up feeling foggy, head pounding, or with a racing heart. Those aren't just signs of poor sleep. They may be symptoms of a circulatory event during the night. Here's our advice. Finish dinner at least 3 hours before bedtime. Give your body time to digest. And if you choose to drink alcohol, stop at least 5 hours before sleep to give your system time to stabilize. After dinner, take a light walk. Around 15 to 20 minutes is enough. This gentle movement helps promote circulation, reduce glucose spikes, and regulate digestion, all of which support safer, deeper rest and lower your stroke risk. Now let's dive into something that could change your life starting tonight. The 2 best sleeping positions for heart and brain health. We've talked about dangerous habits. Now it's time to shift gears and show you how to sleep smarter, not just longer. First up, left side sleeping. This one may surprise some people because we often think of sleep as passive, but how you position your body actually changes how blood flows, how your organs work, and even how your brain clears waste. Sleeping on your left side is especially beneficial for several reasons. First, anatomically speaking, your heart sits slightly left of center in the chest. When you sleep on your left side, you're reducing the pressure your heart has to work against, especially during the night when circulation slows slightly. The result, better blood flow to the rest of your body, including your brain. It's also about gravity. In this position, the inferior vena cava, that's the large vein carrying deoxygenated blood back to the heart, is in a more favorable position. There's less compression, and that helps the heart work more efficiently with less strain. And it doesn't stop at circulation. One of the most fascinating discoveries in sleep science over the last decade involves the glymphatic system, your brain's waste clearance system. Think of it as the night janitor that sweeps away toxins and waste proteins while you sleep, including amyloid beta, the compound linked to Alzheimer's. Studies show that this brain cleaning process works best when you sleep on your left side. Why? It has to do with fluid dynamics and how the lymphatic and glimpy fluids drain. Side sleeping, especially on the left, promotes more efficient cerebrospinal fluid flow, reducing the risk of buildup that can damage neurons over time. There's also good news for anyone dealing with acid reflux. Left side sleeping helps keep the junction between the stomach and esophagus above stomach acid, which reduces nighttime reflux symptoms. This is a game changer for folks with GERD or those who wake up coughing or with a sore throat. If you've ever had that burning feeling in your chest after a late meal, sleeping on your left side could help you sleep more comfortably and protect your cardiovascular system in the process. So that's position number 1, left side sleeping. But what if left-sided sleep isn't comfortable for you? Or maybe you suffer from joint issues or shoulder pain that makes it difficult to lie that way. That brings us to the second best position, and it works for a wide variety of health conditions, especially for blood pressure regulation and circulation. In second position, sleeping on your back with slight elevation. This isn't lying flat like a board, and it's not propping yourself up like you're watching TV. This is a gentle incline, raising your upper body about 15 to 30 degrees. You can achieve this with a wedge pillow, an adjustable bed, or even a stacked pillow setup that doesn't force your neck into an awkward position. And why does this work? First, it promotes balanced pressure across the body. When you sleep on your back with slight elevation, your blood flows more easily back to the heart, especially from the lower body. That's a major benefit for people with poor circulation, swollen legs, or chronic venous insufficiency. There's also a neurological benefit. With a slight head elevation, intracranial pressure can be reduced, lowering the chance of small vessel rupture or microstrokes in people with fragile blood vessels or hypertension. That's especially important for seniors, where even tiny hemorrhages in the brain can lead to long-term cognitive decline. Plus, breathing improves in this position. For people with congestion, sinus issues, or mild sleep apnea, elevating the head can open the airway, reduce snoring, and lower the risk of oxygen desaturation overnight. That means better oxygen delivery to the brain. And again, that means stroke protection. Now, a small but important tip. Elevate your knees slightly too. Place a small pillow under your knees to help relieve pressure on your lower spine. Maintain natural spinal curvature and reduce lower back pain. This combination, elevated head and slightly raised knees, creates a zero-glike posture that reduces pressure across key joints and vessels. But here's the truth that not every position works for every person. If you have sleep apnea, for instance, back sleeping, even with elevation, may still trigger airway collapse. In that case, side sleeping is better. If you have heart failure, the left side is ideal. If you have shoulder arthritis, back sleeping might offer more relief. The key takeaway is not to pick the best position in theory, but the best one for your body. And don't forget the big picture. No matter your position, sleep duration and quality matter too. Aim for 7 to 8 hours of uninterrupted sleep. That's the time your body uses to regenerate blood vessels, balance hormones, repair tissues, and keep your nervous system in check. So, here's our recommendation. Start tonight. Adjust your pillow. Try sleeping on your left side or elevating your upper body. Monitor how you feel. Small changes in how you sleep can lead to big changes in how you age. And remember, how you sleep is just as important as how long you sleep. Your heart, brain, and entire vascular system will thank you for it. All right, we've walked through the science and sleep positions. Let's turn our attention to something just as important, your bedroom environment. Because here's the truth that you can sleep in the right position. But if your sleep is poor quality, fragmented, or filled with hidden stress signals, your brain and heart are still at risk. So, here's how to make your bedroom stroke-proof. First, keep your bedroom cool, ideally between 18 to 20 degrees C. A cooler environment helps your core temperature drop, which is essential for deep, restorative sleep. It also helps lower nighttime blood pressure, reducing strain on delicate vessels in your brain. Next, eliminate blue light after 900 p.m. That means phones, tablets, TVs, and harsh overhead lighting. Blue light suppresses melatonin and delays the onset of deep sleep stages, especially the ones where your brain clears plaque, your heart rate stabilizes, and inflammation subsides. Then, use proper neck support. A pillow that supports the natural curve of your neck can make a massive difference in blood flow to the brain. Avoid overly flat or excessively high pillows. We talked about this earlier. A memory foam pillow with a cervical contour is a great investment. Lastly, eliminate disruptive noises. Sudden sounds can jolt you out of deep sleep, raising heart rate, spiking cortisol, and creating what we call micro-stress events that you might not remember. But your vascular system certainly does. Use earplugs or white noise machines if needed. And if you're someone who wants to take things a step further, let's talk about nighttime health tracking, because your body gives you signals even while you sleep. You just need the tools to catch them. First, try an overnight pulse oximeter, SpO2 monitor. This small device clips onto your finger and tracks oxygen levels. If your oxygen drops repeatedly during the night, it may signal sleep apnea or poor circulation, both of which raise stroke risk. Next, track your HRV, heart rate variability, with a smartwatch or sleep ring. Low HRV overnight may reflect autonomic nervous system stress, often due to inflammation, high blood pressure, or metabolic issues. It's an early marker of poor recovery. And finally, keep a simple sleep journal. Write down how you feel each morning. Do you feel groggy? Have headaches, numbness in the hands, light dizziness? These can be subtle signs of microstrokes, poor oxygenation, or circulatory stress while sleeping. Let's step back for a moment. Most people only think of sleep posture in terms of back pain or comfort. But as we've seen today, sleeping wrong can silently increase your risk of stroke, especially after 60. It affects blood flow, oxygen delivery, vascular pressure, and even toxin clearance in the brain. The beauty of it all, you don't need a prescription. You just need awareness. Change one habit, just one, and your stroke risk could drop dramatically. Exactly. Don't underestimate the power of small nighttime changes. Better sleep position, better environment, better data. You're not just preventing stroke. You're investing in brain longevity, cognitive clarity, and a healthier cardiovascular system for years to come. So now we want to hear from you. Which position do you usually sleep in? Do you often wake up tired or with brain fog? Drop your experience in the comments. And don't forget to like, share, and subscribe if you found this episode helpful. We'll see you next time with more on preventing stroke, memory decline, and restoring vitality after